Hello and good day to everyone. My group will present our topic, which is about the substance abuse. Here is my group member. There are 5 members each group, which contain myself, Amisha Naxalin, and following by Chester.A, Marvelin, Michelle Angel Malia, and Arnis. Introduction of substance abuse. Substance abuse differs from addiction. Excessive drug use in a way that harm oneself, society, or both. An individual will lose his sanity through reasons, and this will bring unexpected problems. Abuse of this drug depends on physical and mental endurance. Physical dependence caused by long-term drug use refer to an altered psychological state in which system of self-insanity increase when the drug is stopped. At the same time, psychological dependence refer to a state of a strong need to continue taking the drug in the absence of physical dependence. The type of substance abuse, such as alcohol, amphetamines, barbiturates, benzodiazepine, cannabis, cocaine, hallucinogens, methaqualons, and opioids.
Hello everyone, my name is Chester.A with the metric number of 74411. Today I would like to share on the factors of substance abuse. First and foremost, there are 3 factors that may lead to substance abuse, which is individual, family, and societal. The first factor is individual factors. Individual factors are those that are unique to the person who is struggling with substance abuse. For instance, studies have found that genetics can play a role in the development of substance abuse disorder. A study published in the American Journal of Psychiatry found that heritability accounted for 40 to 60% of the risk for developing alcohol use disorder. Additionally, according to the study conducted by Kessler, individuals with mental health conditions such as depression, anxiety, or PTSD may be more likely to develop substance abuse problems. Lastly, on the study conducted by Ford in 2014, trauma such as physical or sexual abuse can also increase the risk of substance abuse. Going to the next factor, family factors. Family factors include those that are related to the family of the person struggling with substance abuse. For example, children of parents who abuse substances are at a higher risk of developing substance abuse problems themselves. Family dynamics, such as poor communications, high-level conflicts, or lack of parental supervision, may also be more likely to have children who develop substance abuse problems. To the final factors, which is societal factors. Societal factors include those that are related to the larger community or society in which the person is struggling with substance abuse. For instance, individuals from lower socioeconomic backgrounds may be at a high risk of developing substance abuse problems due to the lack of access to resources and opportunities. Adolescents and young adults may also be more likely to develop substance abuse problems due to pressure from peers to experiment with substances. Availability of substances is another societal factor. Areas with a higher availability of substances may have higher rates of substance abuse. It is important to note that these factors do not cause substance abuse, but they can increase the risk of it. Understanding the factors that contribute to substance abuse can help us develop more effective prevention and treatment programs. In conclusion, substance abuse is a complex issue that can be influenced by a variety of factors, including individual factors such as genetics and mental health, family factors such as family history of substance abuse, and societal factors such as socioeconomic status and availability of substances. We must continue to research and understand these factors in order to develop effective prevention and treatment programs. Thank you. That's all from me, and I will pass to the next presenter.
The implications of substance abuse can be severe and wide-ranging, affecting nearly every aspect of an individual's life. Individuals with substance abuse disorder are often associated with one or more health issues, which can either be a direct and indirect consequences. There are 3 most common implications, which are: first, risk of psychotic episodes, overdose, and death. Once an individual becomes addicted to a substance, such as alcohol or medications like opioids, it can lead to psychotic episodes, overdose, and death. As stated by WHO in 2021, nearly 500,000 deaths are associated with drug use, and there are more than 30% deaths caused by overdose. Second, activating or worsening mental health problems. A long term of substance abuse can change an individual's brain function and structures to a new development of mental health condition such as addiction. Addiction can change the cognitive and behavioral of an individual. Certain drugs can trigger or worsen psychology disorders such as depression, anxiety, and schizophrenia. And lastly, worsening physical health problems. Substance abuse can negatively impact an individual's physical health to a variety of health problems, including liver and kidney damage, lung disease, heart disease, and an increased risk of certain types of cancer. For example, heavy drinking can cause hypertension, liver disease, and cancer.
Ways to prevent substance abuse. First one is education and awareness programs. Teaching individuals about the risks and harmful effects of substance abuse can help prevent them from using drugs or alcohol in the first place. According to the United Nations in 2004, education for drug abuse prevention in schools may be defined as the educational programs, policies, procedures, and other experiences that contribute to the attainment of broader health goals regarding the prevention of drug use and abuse. Education for drug abuse prevention should be viewed as including not only formal but also informal health curricula, the development of a safe and healthy school environment, the provision of appropriate health services and support, and the engagement of family and the community in the planning and delivery of programs. Students should be encouraged to accept professional help. Getting a young person to see a professional when a teacher has recommended it might be challenging. If the student is unwilling to attend the counseling session, then it is unlikely to be productive, even if the kid is eventually convinced to do so. Next is early intervention. Identifying and addressing substance abuse problems early on can help prevent them from becoming more serious and difficult to treat. People with problematic usage or minor substance use disorders can receive early intervention treatments in a variety of locations, such as school, clinics, primary care offices, and mental health clinics. Goals of early intervention is to reduce the harms associated with substance misuse, to reduce risk behaviors before they lead to injury, to improve health and social function, and to prevent progression to a disorder and subsequent need for specialty substances use disorder services. In most cases, these aids are given to people who attend for treatment of some other medical or social issue rather than for substance abuse. Facilitating patient initiation and engagement in treatment when necessary is a key component of early intervention. Other components include educating patients about the dangers of substance use, discussing acceptable or safe levels of use, and offering advice on how to stop or reduce use and related risk behaviors. Some people see early intervention services as an intermediary step between preventative care and treatment programs. People with more severe substance abuse problems may benefit from intervention in these settings because it provides a means of enticing them to enter treatment.
There are two treatments for substance abuse. First, for the counseling and behavioral therapies. Therapy might occur on one-to-one, group, or family basis depending on the needs of the individual. It is usually a number of sessions gradually reducing over time as symptoms improve. First, cognitive behavioral therapy, which help people recognize and change way of the thinking that have associated with substance abuse. Secondly, multi-dimensional family therapy, designed to help improve family function around an adolescent or teen with a substance-related disorder. Thirdly, motivational interview, which maximize individual willingness to change and make adjustment to behaviors. Lastly, motivational incentive that encourage acceptance through the positive response. For the rehabilitation program, long-term treatment program for substance-related disorder and addiction can be very effective and usually focus on functioning and social, professional, and family responsibilities. Firstly, for the short-term resident living treatment, this focus on detoxification and prepares the individual for long period in a therapeutic community through incentive counseling. Second, therapeutic communities. A person seeking long-term treatment for a self-formed addictive disorder will live in a residence for between 6 and 12 months if staff while undergoing rehabilitation. Lastly, recovery housing. This provides short-term stay supervised by staff in each housing to have people engage with responsibility and adjust to a new life. Rehabilitation housing includes advice and handling finances and finding work.
Thank you for watching. That sums up our video presentation for substance abuse. We hope that this video will be able to shed a light for everyone towards substance abuse. Once again, thank you.